The time I get to spend with you guys and answer all your plastic surgery questions from head to toe. And just as a reminder, I am an Ivy League educated, Duke trained, double board certified plastic surgeon with now, I'm aging myself. Let's see, I graduated 2012, 13 years of experience and thousands of cases under my belt. Okay, so today we are going to talk briefly about a subject here, and then of course I'll be happy to answer all of your questions regarding this or anything regarding plastic surgery. All right. So one of the common questions that we get all the time is, "Hey doc, can plastic surgery give me abs?" Okay, and so the short answer is yes, but it definitely has a qualifier, which means it's not for all patients. Okay, you have to be a good candidate in order to be able to get abs through plastic surgery. All right, and so what does being a good candidate mean? It usually means a little bit lower on your BMI. Okay, so the BMI typically needs to be less than about 25 or so. Okay, so the BMI needs to be a little bit lower for the most part, and also you have to have good skin. You have to have fairly good quality skin. You can't have a lot of excess skin. Okay, so anywhere from mild to maybe moderate excess skin, you'll be okay, but you certainly can't have like moderate plus to severe excess skin, and you probably won't be a good candidate for this. All right, so who is it for? It's for the person that's already like in fairly good shape. They really care about, of course, their nutrition. They're already into like an exercise program. It's something that they know they want to maintain for the long term. But no matter how hard they're working out at the gym, no matter how hard they're like following their diet, they just can't get that definition that they always wanted. And so that's where we come in, because like I always say, the best combination is all three, right? Nutrition, exercise, and surgery to get that body that you've always wanted. Remember, we only have one body, right? One life, one body. And then that's it. You don't get another redo. You don't get another body, all right? So you want to make the best of it. Okay, so who is it for also? Is it just for guys? Just for women? No, it's for both. It's for men and women, which is awesome, all right? And so how do we do this? How do we create that ab or athletic look? Well, the mainstay of it is what's called HD or high definition lipo. Okay, this is not your grandma's lipo. This is not the lipo that was done 20 years ago. This is newer techniques with newer technologies where we can really define your anatomy, at least the visible anatomy that we see from the outside, and we create those valleys and shadows so that we have that truly athletic look, and we allow the muscles to basically pop out. Okay, and we reduce fat in all the places that we don't want. All right, and so that's your high definition lipo, but that is only really kind of like one piece or one part of it. Where can you do HD lipo? Well, you can do it just about anywhere, right? So you certainly can do it in the abdominal area. That's the most common, right? And so for men, typically we go with a pretty aggressive HD lipo, meaning that we are doing the entire six-pack, and of course defining the obliques as well. And sometimes you can even define some of the external obliques and serratus muscles up through here as well. Okay. For women, typically you want more of that kind of feminine, softer looking athletic look where you are defining the middle line, perhaps the lines across here, but typically not the six-pack. You do a little bit of definition along the obliques as well. And that's usually what, the look that most women are going for. Can you do the six-pack in a female and a woman patient? Yeah, of course you can. But I'm just saying, just in general, what the trends are, most women are not looking for that. Okay? But it doesn't stop there. You can do HD lipo in the back. You can define some of the back muscles as well. You can do HD lipo in the arms. So you can define, especially for men, you can define that deltoid, define the biceps and the triceps, just to get them to pop out. And then for men also, we can define the chest and really give you that kind of like that strong upper chest look. Okay, big deltoids, we call it kind of like that Superman type upper body, and we can achieve that as well. Okay, so yeah, certainly a lot of things we can do the HD lipo, but that is, like I said, only one piece of all that we can do with what we call the pure total definer package. Okay, so it's the pure total definer package. And so this includes just about everything you need to really get that athletic body that you've always been looking for, okay? And so yeah, the mainstay is gonna be your HD Lipo 360. 360 means that it's the entire trunk, so the front, sides, and back, all right? And like I said with there, you're gonna define those rectus muscles or abdominal muscles. You're gonna define those oblique muscles. You can define some smaller ones if you'd like as well. And in the back, you're gonna define the ones that come along the mid back here also. And you can define what's called the trapezius is also mostly for men. You wanna have kind of that V shape, that strong kind of back muscles there. You can define that. And also the latissimus, which is the muscle that comes along through here, okay? But certainly when you're doing the total definer package, all of this I'm about to talk about is included, all right? That's why we call it a package. Once you add all this stuff together, it's actually a great deal because all this stuff comes in the package, okay? And so the next thing you can do is, of course, you can add any other areas that you would like to add that are of concern. So if you wanted to add arms, that could be done. You wanted to do thighs, especially the inner thighs is a common area. The chin, of course, and then for men, like I talked about, the chest. These are all areas that can be added, and it can be all included within that same package. So you're not paying extra for those areas if you get the whole total definer package, okay? And then there's the fat transfer portion of it, okay? Of course, for women, typically the fat transfer is dedicated to the hips and the buttock to bring out more of that curvy shape, right? That hourglass shape from the front, that signature upside down heart shape from the back, okay? But for men, we can add a little bit to the buttocks and hips. It's done differently, right? We're not looking for rounded shapes there. We're looking more for men to just give a little bit of extra boost, especially more towards that upper buttock region, create more of that masculine look there. And you're really not filling out hip dips, maybe a little bit if they're severe, but really not that much, right? You're not creating rounding hips if you're wanting to go for that masculine look. Of course, for our transgender folk, we are able to then feminize the buttock and the hips, and that's something that we can do, okay? And so for men though, we can also do fat transfer to other muscles to give you a little bit more bulk and to give you a little bit more volume, okay? So what are some common muscles that men like to add volume to? Yeah, certainly the biceps is one, the deltoid is the one up here, the chest or the pec muscle. Those are all super common. You can do the tricep as well. And then you can do, like I said, the trapezius, which are these muscles up here, and the latissimus if you want some of that kind of that V-shaped wider back. We can do all of that for the men as well, okay? And it's funny because a lot of people ask, like, well, does that make the muscle, I don't know, does it make it like softer, like not work out? It's actually quite the opposite. And we've seen longer term studies that have shown that when you put a little bit of fat into the muscle, maybe it's because of stem cells, maybe it's because some of the other stuff that's, with the fat that you transfer, that the muscles actually end up doing better. And so we have a lot of patients where we put a little bit of fat into the bicep and they go to the gym, do their same workouts, and they're able to improve the muscle. The muscle grows better and faster after you do this, and we think it's because it's a lot of the stem cells and other things that come with the fat that we transfer to that muscle.
I verified that.
There you go. Yes, Willie,
for real.
And Willie had the total definer package, and he looks awesome. If you ever want to take a look, you'll see that all chiseled up for sure. Okay. All right, and so the next thing is, what about the skin? So I said, for the most part, you have to have fairly good quality skin to get this procedure done, but does it have to be perfect quality skin? It doesn't have to be perfect, right? If you have some mild skin laxity, or maybe like low, moderate skin laxity, we can still do this, but we're gonna add some devices that are gonna help the skin retract, okay? So the first one here is what's called the Vaser. That uses ultrasound energy. And what it does, it's called, it emulsifies is a technical term. It emulsifies the fat, basically knocks the fat cells off the surrounding tissues so that we can remove more fat with less bleeding, less inflammation, and better skin retraction, right? And who wouldn't want that, right? Less bleeding, less inflammation, better skin retraction. It's like a win-win. So that's why I use Vaser for all of my lipo procedures. But you can also add, if you need some additional skin tightening, you can also add Body Tight, or that's what we use here for now, but also, it could be, and maybe in other practices, Renuvion or J Plasma. the face type for the chin, and for the skin. So body type, face type, they kind of go underneath the skin. If you need something for the top of the skin, then you can add the Morpheus 8, which is the Morpheus microneedling there as well. And that's, like I said, all included within the package if it's needed for the patient, okay? And that's basically all in terms of the surgery itself. But it also includes everything you could possibly think of that you might need around surgery time. And we can help you with that as well. So what does that mean? It means your stay with our partner hotel, AC Hotel. It means post-op care with our partners at Med Miami. It means transportation from the hotel to the clinic back and forth with our partner Goose Travels. And then, yes, we also provide that cosmetic insurance for you that I don't think anybody else in South Florida does. Cosmetasure, it's extremely important in case we do happen, there happens to be, in the rare instance, a complication, and it helps, pay for that potential issue. We end up going to go to the ER or the hospital. It includes garments, massages, and super cool, also concierge pharmacy services, where you get all the medications that you're going to need delivered to you right here in the clinic, and you get them all at pre-op, so you don't have to go running around the entire Miami area to every single CVS and Walgreens trying to find your medications. So we make that all super convenient as well. All right, so that is the Pure Total Definer package. Can I get abs? It's a very long answer to say absolutely yes if you're a good candidate.
We have a few questions, but I'm going to this one because it's related to the topic.
Okay.
And I have, okay, it moves. Sorry, Doc.
Yeah.
Okay, I have skin laxity. Do you recommend the tummy tuck first and then going for this? Are these two surgeries possible to be combined?
Yeah, so that's a great question. So I said, you qualify for this if you're a good candidate and you're relatively good skin. And then, so the question is, well, Doc, what happens if I have moderate to severe skin laxity? What do I do then? Then yes, the answer is get the skin taken care of first, okay? So yeah, for example, if the loose skin's in the belly area, do your tummy tuck first, okay? If we need to also, bring the muscles back together again or strengthen the abdominal wall, we can do it at that time with your tummy tuck, and then come back 3 months later or after for your total definer package, because then you become a good candidate. So you may not be a good candidate now because you don't have the great quality skin, but once we do that tummy tuck, guess what? Now the skin is great quality, it's nice and tight, the muscles are good quality because those have been tightened up as well with that muscle repair or application, and so now, yes, now you become a great candidate for your total definer package.
Any openings for this year?
For this year, yes.
But at the end.
Yes. But the next opening for me, I believe, is sometime late in August, maybe. So yeah, certainly nothing left in May, nothing in June, nothing left in July for myself. But if you really want July, we do have openings for Dr. Wigriff. So yeah, we certainly have openings for Dr. Wigriff, and he's going to have a free consultation day coming up soon. When's that?
This Friday.
This Friday. So if you want a free consultation with Dr. Wigriff and you want to have surgery in July, make sure you take advantage of that deal.
Okay, let's keep going with the question. Can a mini tummy tuck repair diastasis recti without needing to reconstruct the belly button?
So it's not very common. I mean, is it something that's possible? Maybe yes, but for typically no. Like if you really need that diastasis repair, for the most part, you're going to need a full tummy tuck, in which case you are going to then undergo the muscle repair, and you're going to do the umbilical transposition where there is a scar coming around the belly button.
Hi, Doc. It's Tanya. I'm home.
Oh, okay. All right. Well, I'm glad you made it home. That's great. Excellent.
Okay, let's keep with it. Can I do a small lipo with local anesthesia in my belly? Thanks.
I don't do anything under local, really. I do pretty much everything under general anesthesia. So I don't like to use lidocaine, because if you use too much lidocaine, you can have something called lidocaine toxicity. And quite honestly, I want to just eliminate that completely. So for the most part, I don't do anything under local unless it's very a super small area.
Nikki said, "Can you do my surgery?"
Yeah, well, I would love to do your surgery. So in order to do that, make sure you go to our website, okay? Go to www.pureplasticsurgery.com. There you can hit a button that says, start your journey or virtual consultation, okay? And that way you can send in your information, send in your photos, and we can get the process started for you right away.
You're gonna like this question.
Okay.
Why don't you put your patients in a faja right away surgery?
Right. So different surgeons have their own styles and their own reasons for doing things. Okay. But I do not like to put the faja on the first night because I want to make sure that the skin is doing okay. Right. So you just had surgery, whatever it is, Lipo 360 BBL, and so I beat up that skin for a couple hours or more. And so I want to make sure that the skin gets a little bit of time to recover before putting it into compression. And so what we're going to do is that you're not going to have your faja that first night. The next day, we're going to do what's called a skin check. We're going to check the skin, make sure everything's okay. And if it is, then you can go ahead and get in your faja.
Do you do implant exchange? Because I want to go smaller.
Definitely. So definitely do it. We can do implant exchange, and we do that every day. The one thing you got to think about, though, depending on how much smaller you want to go, you may also need a lift, okay? So not just the implant exchange, but also a lift, because if you're going much, much smaller, there may be some stretched out excess skin, and that's going to be, we're going to have to remove that and lift the breast.
Have you done BBL fat transfer to hip dips to transgender women?
Yeah, definitely. So that's something that's actually not too uncommon. So a lot, like I said, a lot of our transgender patients, I was saying there, if you're transgender and you want to, feminize, the look, then yes, we can definitely add fats to the buttock and the hips to create more of that, that hourglass shape from the front and that upside down heart shape from the back.
Love you, Dr. Earle. I had my implants with you in 2022. They are perfect.
Awesome. I am so glad to hear it. And if you want to do anything else, we're always here for you.
The TikTok's on fire. TikTok's on fire.
Nice.
Mil ocasiones. This month. En español, porque también hablamos español.
Sí, claro que sí.
Me hice el Tummy Tuck con usted.
Okay.
Si quiero volver para una lipo HD y BBL, ¿se pueden hacer juntos?
Sí, no, seguro. So, la lipo HD, lipo 360 con alta definición o HD, se puede hacer de seguro al mismo tiempo que la lipotransferencia a los glúteos y a las caderas. So, se combina el HD lipo con el BBL y no hay problema.
Okay. This patient said that she was denied twice for her BMI. So if you can explain a little bit about the BMI limits, doc?
Yeah, so every surgeon's going to have a little bit different BMI limits. Certainly, but there is going to be a certain limit to a BMI in terms of from the safety point of view when you're doing surgery that is completely elective, right? And in an outpatient surgery center, like the one we have here at Pure, okay? So there are several studies that have shown that the higher the BMI is, the higher the complication rate, okay? This is pretty much proven through, many studies, many years of literature and research, okay? And so my BMI limit is 30, all right? And so why is that? Because at 30 is when the complication rate, so say this is 30 here, complication rates kind of start slow, and then at 30 is when they start to inflect and go, significantly higher, okay? And so that's why it's my BMI limit. And what are the potential complications that go up? Well, one of the ones we worry about the most is that for blood clots. So the complications for blood clots in the legs or in the lungs. So in the legs are called DVT or deep vein thrombosis. In the lungs are called PE or pulmonary embolism. So that is something that we want to avoid. And then of course, risk of having issues with the wound, so wound breakdown, open wounds, things like that, it goes up as well. Potential respiratory issues at the time of surgery or afterwards can also go higher. So for all these reasons, we want to have a limit as to what we're going to do in the outpatient surgery center.
Doc, how can I make hips rounder without the need to get a full BBL?
All right, so there's a couple options there. If we're just maybe focusing on the hips, we can do maybe just a smaller lipo, right? A lipo of a limited area, say maybe just the back. So instead of a lipo 360, we just do a lipo 180, or a lipo of a certain area that's bothering you, and then just use that fat and only do transfer to the hips. That's one option. Or if you're like a super skinny patient, very low BMI, or maybe you've had multiple lipo, lipo procedures in the past, and there's just no more fat to take, then another great option that we have now is called alloclay, okay? So alloclay is structural off-the-shelf fat that we basically get off the shelf, and we can use it to fill in areas such as the hip dips, and it's worked out really, really well. So if you're a patient that has no fat because you're either very low BMI, I'm talking like BMI 18, 19, okay? Or maybe you've had multiple surgical procedures, liposuction procedures, or simply maybe you don't want to do the whole general anesthesia and the big recovery anymore, then the alloclay is a great option, because the alloclay is done simply under local in the clinic setting. Pretty much you're in, you're out, no downtime, and you're back to regular life. No need to do all the pre-op stuff, no general anesthesia or anything like that.
How soon after a BBL with Lipo 360 can I get an extended tummy tuck?
So how soon after a BBL can you get your tummy tuck? All right, I mean, if you're gonna do it that way, you could do it 3 months later, but I recommend actually doing it the other way around, okay? So if you haven't started your process yet, my recommendation would be that you start with your extended tummy tuck. Do your tummy tuck first, get rid of all the loose skin, do the muscle repair, okay? And then come back 3 to 4 months later and do your Lipo 360 BBL.
Can breast implants jiggle if you put them subfacial?
Can they jiggle? Yeah, I mean, I assume you're asking like a natural jiggle, like do they look natural? Yeah, you can certainly do that. The subfascial approach is my preferred approach for breast augmentation. I think it is the best of all worlds. It is a newer technique, okay, so it's not the same as what, sometimes people confuse it with the subglandular approach, which was done way back in the past, where you're just putting the implant underneath the breast. That's not exactly what's happening right now. This is a newer technique where you're putting it in a special place, which is between the fascia and the muscle. So the pec muscle has this thicker layer over top of it. It's called the fascia. And so now you can kind of sneak in between there. So the raw kind of muscle stays down, the fascia, and of course the rest of the breast comes up, and you can put the implant in that spot, okay? And it has the best of both worlds, because the capsular contracture rate is still super, super low, less than 1%, but at the same time, you don't get what's called an animation deformity, meaning that when you do certain movements, when you activate the pec, okay, the implants don't move around, okay? And that's one of the issues with the submuscular approach. So when you're placing the implant beneath the muscle, okay, not only are you're obviously you're damaging the muscle in a sense, because you're cutting the muscle, you're releasing the muscle. So on the one hand, you're damaging the muscle, and it won't function properly afterwards. And also, you can also get what's called an animation deformity, such that when you activate that muscle, the implant kind of jiggles and moves around, okay? And we want to avoid that as well. So I think the best approach for your straightforward kind of breast augmentation is that subfascial approach.
6 months post-op from a BBL, a lot of the fat went away, and I want a second round of the BBL to fix some indents.
Okay.
Will fat stick better with the second round?
So I think it does, to a certain extent, it does stick around better, and you also kind of need less fat the second time around to achieve your look, because you've already kind of established a foundation, okay? And so what I tell my patients is that you want to think of it like Legos or building blocks, okay? So you did your round one, some fat was transferred, perhaps we lost a little bit more than we wanted to, but that foundation is there, okay? We're not starting from zero again. And so you've established that foundation, you set your kind of baseline Legos or building blocks, if you will, and so now you're just going to build on top of that, okay? So that fat does tend to do better, and you tend to need less fat to achieve, the final look that you want.
Can I have an inner thigh lift with a BBL together?
Typically, no, not a lift, okay? You can do inner thigh lipo or even lipo with a body tightening procedure like body tight or Renuvion, but not the thigh lift and the BBL at the same time, okay? We have certain rules, at least here in Florida. I'm talking specifically in Florida. We do have certain rules here in Florida, and that's when you're doing a procedure where you're making a large incision, such as a thigh lift. Then you get very limited by the Department of Health. They say that then you can only remove 1 liter of fat via liposuction, okay? And that's typically not enough fat to be removed in a full lipo 360 and not enough fat to then transfer for your BBL. So I do recommend separating those procedures. In this particular case, you can do it in whatever direction you'd like, but you can start with your lipo 360 and BBL and then come back later for your thigh lift.
How can I lighten and soften my belly button scar post tummy tuck?
Okay, that's a great question. So it depends on what's happening with the scar. So say if you're having a hypertrophic scar or a keloid scar, typically the first step is to inject it with a steroid called Kenalog, okay, to see if that will help flatten it out and sometimes lighten up the color as well. In terms of the discoloration, there's other things you can do such as bleaching creams or also certain lasers that can help, okay? But if all of that fails, then the last resort is doing a scar revision. So basically removing the old scar and starting all over again.
Okay, Courtney, she said, have implants under the muscle having complications because new doctor wants to put on top? What are your thoughts?
Yeah, so like I was saying before, but on top, not just regular on top. So this doctor that you're speaking to, ask him if when he says on top, does he mean subfascial? Okay, that's the placement that I do recommend, which is on top of the muscle, but between that muscle and the fascia. That is also what I recommend nowadays, because you have, again, the best of both worlds. You have very, very low capsular contracture rates, but you avoid the possibility of an animation deformity. And also you're not hurting the muscle when you do this, right? So when you put an implant beneath the muscle, you by definition hurt the muscle because you have to divide the muscle, you have to release the muscle, you turn it essentially into a non-functional muscle that then also causes these animation deformities. So you'll want to avoid all that. So yes, put it on top of the muscle, but in that subfascial plane.
Can I have a lipo 360 with a tummy tuck with hyperthyroidism?
So I would not recommend that, okay? Especially if you have hyperthyroidism, okay? My recommendation would be to separate out those 2 procedures. So start with your tummy tuck and then come back 3 months later for your lipo 360, okay? When you combine the 2, your complication rates go way up. Complications again of wound breakdown, skin dying or skin necrosis, of blood clots in the legs or the lungs, which can potentially set you in the hospital or potentially even be fatal. Infection, all these complication rates go up, so I would not recommend combining all of those. And also, like I said, here in the state of Florida, if you do a tummy tuck, you're limited to removing only 1 liter, which is typically not enough. You probably need more than 1 liter to be removed for like a true liposculpture 360. So do your tummy tuck first and then come back 3 to 4 months later and do your lipo 360.
Okay, for all the patients that are asking about pricing, scheduling and booking, doc.
Okay,
Yes.
let's see, let's put that all the way up here. So you want to go to our website, okay? All right, so our website is www.pureplasticsurgery.com. There you're going to find a form. There's a shorter form that basically says start your journey. There's a little bit of a longer form, which is the one I recommend, which says virtual consultation. There you're going to fill out a questionnaire with multiple questions, and then you're going to also send us some photos. So that's basically your virtual consult that comes here to our patient care coordinators, and then they show that to me. Based on your response to the questionnaire and your photos, I can make a recommendation, and then they'll give you placing your deposit, etc., etc. So that's what I highly recommend. Of course, you could always call us, and we're happy to help. So at 305-230-4326, All right, that's our phone number. You can call us directly, and you can just go ahead and directly speak to a patient care coordinator as well. Okay, and remember we have 3 different types of consults. We have that virtual consultation, which I just talked about through the website, and that's free of cost, no charge. Okay. Then once you do that, if you want to have a video consult, because perhaps you're from out of town, we get a ton of patients. Actually, the majority of our patients are from different states and different countries. Then you can do that video. You can do a video consultation. That is going to have a fee of $250. But if you book the surgery, that $250 goes towards your surgery. So you're not losing that money. It's not extra money that you're paying. All right. And then if you want to have an in-person consultation, that can be arranged as well. That will also have a fee of $500. But once again, if you end up booking the surgery, it goes towards the surgery. So it's not money that you're losing, and it's not extra money that you're paying. Okay. All right, everybody. Okay, well, I hope everyone's up to date with the Pure Total Definer package. It's been a while since we talked about this, but remember, it's certainly available. And the guys out there, I don't know if there's many of you out there, guys, this is a great thing for you. I mean, we can define those abs, we can etch out the pecs, give you some nice strong arms and deltoids. It really kind of can make a huge change and give you that athletic body you've always been looking for. All right, well, I look forward to seeing everyone next week on Hump Day with Dr. Alex Earle. I'll see you then. Take care. Ciao.
Okay.